You've been told you have diverticular disease, but what is it? How do we treat it? When do you need surgery for it? In this video, I aim to explain to you what the disease is and what we can do for you. Hello, my name is Mr. Rajiv Paravalli. I'm a consultant colorectal surgeon. I work in Birmingham with Midlands Colorectal. One of the common things that I deal with is diverticular disease. Diverticular disease is essentially wear and tear of the colon. It happens more frequently on the left side of the colon in an area known as the sigmoid colon. It can be regarded as wear and tear of the bowel and generally happens in the older age group. However, it can be seen in younger individuals. The harder your bowel works, the more it is stretched and the more individuals form outpouchings at areas of weakness known as diverticulum. When these diverticuli are numerous, it's called diverticular disease. Diverticuli that are inflamed become called diverticulitis. What predisposes to diverticular disease? Basically, when your bowel works hard, it wears quicker. So individuals with a poor diet, low in fiber, low individuals that exercise infrequently, all are predisposed to diverticular disease. Lower abdominal pain, listen to this. Typically speaking, diverticulitis presents with lower left-sided abdominal pain. Severe diverticulitis can be associated with nausea, vomiting, fever, chills on top of this. If you have severe abdominal pain associated with these symptoms, you need to be assessed. When you are assessed, you will see your attending physician who will take a full history, examine you, and perhaps do some blood tests and further investigations. If you have severe diverticulitis, it is really important that you are assessed and treated. Generally speaking, simple antibiotics is all that is necessary, but it is important that complications such as perforation, abscess formation are identified and treated promptly to save your life. How do doctors confirm diverticulitis? Assessment for diverticulitis starts with a history. Your attending physician will take a full history and examine you. Following on from examinations, you will get some blood tests and investigations. Your investigations in the acute setting almost certainly will include a CT scan of your abdomen and pelvis. This is what will diagnose diverticulitis. Once you have recovered from the acute setting, your physician, doctor, surgeon may recommend that you have further investigations by way of a colonoscopy. The purpose of the colonoscopy is to make sure that there are no hidden causes of the inflammation and pain. What we are looking for in this situation are polyps, inflammatory bowel disease, and possibly cancers. Rest, fluids, and antibiotics may be all that is required to treat diverticulitis. Diverticulitis can cause very severe abdominal pain. It is important you are assessed. Once you're assessed and a diagnosis is confirmed, you will be diagnosed with complicated diverticulitis or uncomplicated diverticulitis. Uncomplicated diverticulitis is when you have inflammation of the bowel, the colon in that area without complications such as abscess or perforation. In this situation, rest, fluids, and oral antibiotics is all that is required. If there is complicated diverticulitis, further interventions may be necessary. The majority of people with uncomplicated diverticulitis are able to get back to work and back to normal activities of daily living within a few days of having oral antibiotics. Surgery isn't always needed for diverticulitis, but sometimes it does save lives. Understanding your options for diverticulitis can significantly reduce your anxiety. Generally speaking, surgery is not necessary for uncomplicated diverticulitis. Sometimes it is offered for some individuals who have repeated bouts of uncomplicated diverticulitis. This is when it is really the pain is interfering with your life, making you take days off work, etc. In this situation, it may be that you will benefit from removing that segment of diverticular disease to stop that area being inflamed on a regular basis. This is a much more lengthy discussion, and you will need to discuss the pros and cons of this approach with your surgeon. Surgery may be much more relevant in the setting of complicated diverticulitis. Complicated diverticulitis may be significant inflammation with abscess around the bowel itself, or a significant perforation. This is where there is a hole in the bowel and there is release of bowel content into the abdomen. Generally speaking, individuals with complicated diverticulitis are very sick. Surgery for complicated diverticulitis can be life-saving. The exact nature of surgery in complicated diverticulitis will depend on the individual, and the surgery will be tailored to what is found at the scan and at the time of operation. Your surgeon will be able to discuss this with you in detail. Prevention of diverticulitis starts with simple habits. A healthier bowel starts with lifestyle changes. Diverticular disease is wear and tear of the bowel. Once it's happened, unfortunately, we cannot reverse it. What we can do is prevent diverticular disease from worsening, and that means reducing the rate of wear and tear of the bowel. That means that individuals should have good bowel health. What does that mean? That means adequate hydration in the region of 2 to 3 liters a day, avoidance of constipation, adequate fiber intake, and a good, healthy, balanced diet. This means your bowel works less hard and is less likely to wear and produce more diverticulae. These simple measures can also prevent further attacks in already established diverticular disease. When you have diverticulitis, often it is better, safer to have what we call a low residue diet, because high residue diet irritates the already irritated and inflamed bowel. Once the pain is settled, we would recommend that you revert back to a high fiber diet. The key message is that diverticular disease is very common and very manageable with key, simple lifestyle changes. If you found this content helpful, please subscribe to see more content just like this. I regularly share content like this, jargon-free advice and information for patients to help with their bowel-related condition. If you would like to arrange a consultation, please click the link below. If you know individuals that might benefit from the content in these videos, please share this content with them.